Can everybody see those slides there just before I start? Just want to make sure that they're up.
Yeah.
Thank you. Thanks. Hi, everybody. My name is Elena Hamilton and I work in the Mental Health Commission. I just, first of all, before I start and introduce myself properly and the rest of the team here on the call, I just wanted to thank John and Michael and Michaela and the rest of the team for facilitating this session today, and also for inviting us to come and talk to you about our public consultation. So we're really delighted to be here and to be able to talk to you about it today. So as I said, my name is Elena and I'm the Head of Regulatory Practice and Standards in the Commission. And I'm also here with two of my colleagues, Alison Connolly. Alison Connolly is a Research and Regulatory Manager, and Alison will also be, I'm going to do a couple of opening slides and then I'll hand over to Alison, who'll talk you through in more detail around the survey and the form and how you can interact, I suppose, with the public consultation. And Aisling Downey, a research officer, is also joining us on the call, and we'll be available, like Michaela said, to answer any questions after the presentation. Sorry, now I'm having trouble to move on the slide. Sorry, bear with me 1 second. It was working in our testing environment, but doesn't seem to be working now. Oh, there we go. Okay, so some of you may be aware who the Commission is, and some of you may not. So I've left this slide in here just to kind of give everybody an overview of what we do with the Commission. So the Commission, we're the regulator of mental health services in Ireland, and we operate under the Mental Health Act. So our core regulatory functions are to register mental health services, and then we also inspect those services, and then we would also monitor how those services are complying with their legal requirements. And then we would also use our enforcement powers where they're needed. So for example, the Commission does have the power to prosecute or to close a service. We also arrange tribunals for people who are detained in a mental health hospital to make sure their rights are upheld. And another aspect of our work that you may not be as familiar with is that we develop standards that tell services and also the public how those services should be delivered. So for example, we have different rules, codes of practice and national standards. So we have rules on things like the use of restricted practices, things like seclusion and physical restraint. We have codes of practice on things like the admission of children to mental health inpatient services, and then we also have national standards, and that's where the quality framework that we're talking about today fits in. It's national standards. So the quality framework, you may or may not have seen it before. I've included a picture of it here on the slide. It's available on our website, and I think I've included a link kind of below to where you can find it. The quality framework is an extremely important document. It sets out kind of key and important standards for mental health services in Ireland. Most importantly, it shows services how to continuously improve their quality for their service users. It applies to all types of mental health service. So whether it's a public service, whether it's a private service, whether it's a voluntary service, and it also applies to any kind of type of service provided. So whether it's an adult service, whether it's a child and adolescent service, it could be psychiatry of later life, forensic, these standards apply to those services. And it equally applies to all mental health services, regardless of whether they're being delivered in like a service user's home, within a community setting, whether it's a residential service or a non-residential service. So for example, you know, an outpatient department or a day hospital, or again, within inpatient facilities. So I just have some examples here from the current quality framework, like some of the standards that are currently in the framework. So the first one there is that each service user has an individual care and treatment plan that describes the levels of support and treatment required in line with their needs and is coordinated by a designated member of the multidisciplinary team. Another is that service users' rights are respected and upheld. Another is that service users receive care and treatment in settings that are safe and that respect the person's right to dignity and privacy. And another example is that service users receive care and treatment from quality staff with the appropriate skills. So they're just an example of the types of standards or requirements that the quality framework sets out. So what are we doing and why are we here talking to you today? So that quality framework was developed in 2007. And as you can tell, that's a very long time ago. So it's very timely that we need to review it now and update it. So we want to make sure that the standards in the framework are still relevant, but also that they reflect best practice in mental health care and treatment now, so that they're up to date and in line with current evidence and current best practice. And we also, really importantly, want to make sure that the standards are informed by those people that use them. So both people accessing mental health services and then also staff providing them. So how are we doing it? So we've developed a project team and I've set out here on this slide here. So these are kind of the key steps on that project. And we're at the early stages of it. We're at that first bullet point where we're conducting a public scoping consultation. And this is ongoing and it's open. And that's what we're here to talk to you about today, about how you can get involved with this public consultation. And it's around how you can engage with us to put forward your views on what the quality framework should include or what it should look like, and equally what mental health services should look like. So we think this is a really, really important part of the project. We're doing it early on so that it will inform the rest of the development of the standards. We're also at the same time, we've commissioned the Royal College of Surgeons in Ireland, or CSI, to complete a literature and evidence review. So that will be quite a detailed evidence review of both literature, up-to-date research, and then also to look at other comparable countries or jurisdictions to see what they do. You know, is there something that we can learn from another jurisdiction that we should be applying here in Ireland? So that's kind of another key piece that's going on at the moment. And following on from that, kind of the next steps of the project will be that we'll be conducting focus groups, and that will include both with service users, with staff, and other kind of, I suppose, key groups of people that we feel would be particularly important to get more detailed consultation with around the development of the standards. And then we'll have another consultation on a draft set of standards. So we'll develop a revised quality framework following on from both the public consultation, the literature review, and the focus groups. And then ultimately we will publish a revised quality framework. So at this point now, I'm going to hand over to my colleague, Alison, who's going to talk to you about how you can get involved in kind of the practical way that you can use the form and how you can do it. Alison, I'll hand over to you if that's okay.
Thanks a mil, Elena. I'll nod if I need the slides moved on.
Sure.
Yeah, lovely to be here. And yes, as Elena mentioned, I'm going to chat a little bit about the kind of logistics involved in the consultation and how people can get involved. So as we mentioned, we want as many people as possible to contribute to this scoping consultation, this kind of first step in this project, and give us their thoughts on both the current quality framework, but also what they would like to see in a revised quality framework. We, and when I say we, really a lot of this analysis will be done by the Royal College of Surgeons that Elena mentioned, where we're using their analysis expertise to give us a hand with some of this. That we're going to review all of the feedback we receive and then use it to inform that the other stages that Elena mentioned and the development of the standards. So I thought we'd have a look at some of the questions in the actual form just to kind of highlight what we're looking for and how to fill it out. And there's 13 questions in total, which might seem long, but you obviously don't have to answer them all, and we're just trying to capture as much information as we can. The first two questions in the form, and I haven't pulled them out because they're about whoever is filling out the form. So they're, whether you're someone who has engaged with services before, whether you're a staff member, we're not looking for any sort of identifiable information. It's really just to give us an idea of whether we've received feedback from a broad selection of people. And then the final two questions in the form, again, which I haven't pulled out, are about future engagement opportunities. So what we're asking there is whether you, the person filling it out, would be interested in partaking in further consultation, more detailed consultation, or whether you have any ideas about other organizations or individuals we should be speaking to, because we're conscious that we don't want to miss anyone. This is a great opportunity for us to revise these standards, and we want to make sure we get input from everyone that we need to hear from. So if we just move on to the next slide, Elena, I've just pulled out some of the questions. So on the feedback form, and we'll talk you through kind of where to find that afterwards, but the first kind of substantive question is a fairly simple one. Are you aware of the quality framework? And what we're really trying to capture there is the extent to which the public and staff are aware of and using the current quality framework as it stands now. That, for a lot of people, they may not be familiar with it, and that's fine. And some of the questions below this, if you're not familiar with the quality framework or you haven't read it or used it, you won't need to or be able to kind of answer the following questions. But if you are, if in the course of, whether that's engagement with services or working in services or supporting friends or family who are engaging with services, if you are aware of the quality framework, we ask some follow-up questions like how frequently you use it or refer to it. We then ask about any particular strengths of the existing quality framework. Is there anything that you think is particularly positive about it? And this is really trying to capture, are there things that we need to make sure are retained? Are there things that need to be, that are very important, might need to be strengthened or updated? We also then ask what might be missing from the quality framework. And again, this will be particularly interesting if people are using it regularly. Is there something that you think that really should be referenced or detailed in the quality framework, but it's not at the moment? So that's what we're looking for from question 6. Can pop on there, great. Question 7 again is really to make sure that we have as much information as we can get to revise this. So we're asking whether the person filling out the form has any documents that they think we should look at to inform the revised quality framework. And those documents might be, other sets of standards that other regulators use. It might be documents from other countries that have come across your desk, or that you're really any documents that you're aware of that we should also be aware of and have a look at before we get into the bones of updating the quality framework. Question 8 then is again making sure that we're getting as much information as we can, is what organizations or individuals. And we say within the mental health care sector, but actually I would say if there's people beyond the mental health care sector specifically that you think should be engaged, we'd welcome that as well. But it's which people should we engage with when developing the revised quality framework? And that's to make sure there's not any organizations or individuals with particular expertise that we maybe have overlooked or haven't reached out to. Question 9, 10 and 11 then are the slightly broader, more open questions that we hope that, most people may have an opinion on, even if they're not familiar with the quality framework at the moment. So question 9 is, what does a high quality mental health service look like for those using it? And I mean, it's kind of self-explanatory, but it's really what should people who are using mental health services expect from the service that they're getting? What does high quality look like? Question 10 then is slightly different, but it's capturing the fact that we know there will be people filling in this form that haven't necessarily accessed services themselves, but have supported friends or family to access services. So it's, what does a quality mental health service look like for friends, family and carers? And that really is to capture, you know, how should those people be involved? What should the service be conscious of when delivering care? Question 11 then, and this is kind of the final substantive one, is what is needed to deliver a quality mental health service? So that's, you know, you might have thoughts on what high quality means, but this is really to ask what you think is then needed to get services to that point that they can deliver high quality services. So what is needed might be around, you know, resources, staffing needs. It might be about, you know, the actual service itself. It might be about further standards or training. It's open really to whatever people think. And that is the final kind of substantive one. Move on just to some kind of notes on the form itself. So as I mentioned, you don't have to answer all the questions, and we're very aware that, you know, people won't necessarily be able to or be interested in answering all the questions on the form, and that's absolutely fine. You don't have to give us any information about yourself. Though, as I mentioned, it helps us to make sure we've heard from a broad selection of people. If we kind of know, okay, we've heard from lots of people accessing services and not so many staff, or vice versa. There's a few different ways that you can fill in the form. And actually, the important thing that's actually on the next slide, but I should have put on this slide, is the deadline. So the consultation was actually due to finish last Monday, but because of a couple of things, including the HSE cyber attack, but also just the level of interest that we got, we've extended the deadline. So the new deadline is Monday, the 5th of July. So there's a few more weeks to fill in the consultation form, and there's a few ways of doing that. So the first thing to do is to go to mhcirl.ie, which is our website, and we have a kind of a yellow banner along the top of the page, which will bring you straight to the page about the public consultation. You can also use the search function. If you look for quality framework or consultation, it should come up there. When you're brought to the page, you'll have all the kind of documents you might need to fill in. So the first thing you can do is, there's a link on that page that will actually bring you straight to an online consultation form, where you can just type straight in your responses and click submit, and it will go straight to us and to the RCSI. You can also access a PDF, a copy of the form, and fill it in text and then send it by email. You can print off the form, fill it in by hand and post it. All those details are also on the website for kind of who to post it to. And where to send it via email. So there's a couple of different options. If you know you or someone you know can't print it, or you know isn't able to access it online, you can also contact us and we'll send you a paper form in the post, so that you know to facilitate as many people responding as possible. I think that's the end of that slide. And I've already mentioned this, the deadline is Monday, the 5th of July. As Elena mentioned, I think we said close of business on Monday, the 5th of July. So kind of 5:30, 6. There will be further consultation opportunities. This isn't the kind of the only opportunity for people to feed into this process. And there will be a consultation once we have a draft quality framework as well. So that's that. But yeah, we would absolutely welcome as much feedback as possible at this stage before the 5th of July. So as I mentioned, further info can be found at mhcirl.ie. I'm always worried I've mistyped that, but that is correct. You can also we have a standards email address, which is for our team. So you can contact us at that if you have any questions or like to get a copy in some other way. And we just put this in here. If you know there are any other concerns you may have about a particular service, we also have avenues for people to contact us. And I think we'll be sharing these slides afterwards, but the email address is concerns@mhcirl. If you need to follow up on anything else. And that is that.
Thank you, Alison. That was pretty good.